Hi, I'm Dr. Bruce Davis, DIDD Director of Behavioral and Psychological Services. I'm here today to talk to you about the antecedent behavior consequence chart, part of the IDD toolkit. Whenever we're gathering data to design behavioral interventions, that has to begin with assessment. And assessment includes some form of data collection. There are two basic forms of data collection. One are indirect methods, which include interviews or checklists. The other is direct methods, which includes a direct observation of the behavior in question. Direct methods are typically preferred over indirect methods because, first of all, they provide a more reliable assessment of what has actually occurred, and secondly, they are more likely to lead to effective intervention. A common method for direct observation is the ABC chart, or the antecedent behavior consequence chart. Let's start with an example from the IDD toolkit. So looking at the form, at the top, it requires the person's name and date of birth. So those are pretty standard. Then if you come down below, you'll see a place for the date, the time, and the observer. So those are all related to a specific incident that has been observed for the person in question. Then you'll see a column for pre-existing conditions. Pre-existing conditions are factors that increase the vulnerability or sensitivity to triggers. So this might include something like the person is not feeling well, feeling sick, etc. Another way of understanding these pre-existing conditions are that they're contributing conditions. So they didn't actually trigger the problem, but they made it more likely that the problem might have occurred. The next thing that you'll include are antecedents or triggering conditions. So it's almost as if the pre-existing condition loaded the gun and the triggering condition set off the behavior in question. So that's what happened just before the behavior occurred. And here you want to include both the setting and the activity in which the behavior occurred. The next part of this is giving information about the behavior. As you describe the behavior, you want to describe it as accurately and specifically as possible, including the frequency, so how many times it occurred, the duration, how long the behavior occurred, and the intensity. And it asks you on this form to rate that intensity on a scale from 1 to 5, with 5 being the most severe. Lastly, you include the consequence to the behavior, or what occurred directly after the behavior. So those are the 4 components of collecting data on this antecedent behavior consequence chart. Now let's go to an example that's shown on the form. If we look in the first column, it has the date, time, and observer. So the date was February the 6th of 2010. The time of the incident was 6:30 to 7:10 p.m. It's really important to include the beginning and end time of the episode because that will give you a very accurate reading of the duration of the episode. And then it also includes the observer, Renee, who was a primary staff member that worked with John. Some of the pre-existing conditions that led to this incident for John included that John's mother was in the hospital with a broken hip, could not visit him. This is a common pre-existing condition for problems that people may experience because they've had less contact with their family, they miss their families, and so that kind of sets the occasion for them to be emotionally dysregulated. Also, in this incident, John had a toothache. You frequently find that medical conditions contribute heavily to the existence or the occurrence of problem behavior. And then John's usual primary staff member was on vacation. So the people that he was used to taking care of him were not there on this particular occasion. So the antecedent for this was that John was eating supper in the kitchen when another resident bumped into him when passing food. This includes information about the setting. So you see that he was in the kitchen, and the activity. So this was during mealtime. And ultimately that someone just bumped into him, which might on an ordinary occasion be a relatively minor incident. But on this occasion, with all the other things that were going on with John, it led to a problem behavior. So, as we get to the description of the problem behavior, John started to yell, threw his plate across the table. He ran out of the room and screamed for 10 minutes and threw cushions around the living room. The intensity was rated as a 4 on a scale of 1 to 5. As we move over to the consequences, we read that staff tried to direct John to his room for time out, but he became more agitated. They also tried to distract him with ice cream and were unsuccessful. They directed other residents to leave the room. John began to hit staff when they approached him. Staff observed him from a distance, gave him time, and reduced the stimuli or the things that were going on around him, and he eventually calmed down in about 30 minutes. So if I add that 30 minutes to the 10 minutes that he engaged in screaming behavior, that gives you a grand total of 40 minutes. And we saw at the beginning that the duration of this incident was from 6:30 p.m. to 7:10 p.m. So that is an example of how data is collected on the antecedent behavior consequence form. This antecedent behavior consequence form can be found at iddtoolkit.org. You can also find a link attached to this video. If you have any questions about the form, you may contact me, Dr. Bruce Davis, at 615-532-1610 or bruce.davis@tn.gov. Thank you for your attention.